Hi everyone, thanks for joining me today. If you don't know me, I'm Grace Meehan and I'm a clinical pharmacist. And I'm also a certified menopause practitioner with the North American Menopause Society. I looked at my calendar recently and saw that I'm on to speak to you today. I had to take a step back and think, what am I going to speak about? There was nothing that was really jumping out at me that I was inspired and excited to talk about. And then all of a sudden it hit me. It just honestly came out of the sky and hit me that I wanted to speak to you about alcohol and its effects on health, especially from midlife and beyond, but also, younger crowd can get information from this as well. Now, I'll start off by saying this is not, a shaming video, not at all. It's just I wanted to give information because alcohol surrounds us. It's always been so socially acceptable to drink. The marketing's amazing. It's marketed to young and sexy and thin and beautiful people who are having a great time. And, that's just the way it's been. And so it's been socially acceptable. What I find in being a pharmacist and a menopause practitioner is that more and more people are drinking, especially I'm finding more and more menopausal women are drinking a little more and more, possibly because of the marketing. If you're going to have a good time, you're going to have a drink. But also, if you're stressed, alcohol can take the edge off. Maybe I'll have that nightcap to help me sleep, right? On TV, on Netflix, everywhere. That's the way it is. So I just wanted to give you some of the data, but this is where I'm excited. I want to also give you a challenge as well. Okay, so let's take a few steps back. So in my my practice, I see women who have hot flashes and they're bothersome. Well, alcohol affects hot flashes in a negative way. It does, right? I have women who have sleep issues. And certainly by aging, sleep can change and you get more and more people with sleep issues. But I've got to tell you that alcohol has such a negative effect on your sleep. And sleep is vital to your well-being. It's vital to your brain. It's vital to your energy. So what happens with alcohol is that, maybe you'll fall asleep pretty easily. And that's what people think, oh, that something before bed is going to help me put me to sleep. But invariably, you're going to wake up at 2 or 3 in the morning and you're going to be wired and you're going to feel agitated, maybe a little bit anxious. And why does that happen? Well, it happens because alcohol has a direct effect on our stress hormone cortisol. So when we drink, our stress hormone cortisol goes up. So, even though you're falling asleep quickly, it's negatively affecting your sleep. Now, it's when you sleep that you make important neurotransmitters. It's when you sleep that, your body takes out the garbage, gets rid of the bad stuff. That's when your body repairs itself. So you might feel more achy the day after drinking. You may feel down. You may feel anxious. Certainly you're not going to have motivation and the initiative that you wish that you did. Okay, so absolutely sleep negatively is negatively affected by alcohol. I get women in my practice who, feel kind of flat, a little depressed. They're not feeling joy anymore. Well, alcohol has an effect on our mood, right? Even if you're not drinking excessive amounts of alcohol, especially as you're middle age, it affects you more quickly, more acutely. So, if there's a mood disturbance, alcohol is going to contribute to that. If you haven't read Kent McLeod's book, The Biology of the Brain, it's amazing. And he goes into more of a deep dive of the effect on the microbiome of so many things. Well, alcohol affects the microbiome in a negative way. And the microbiome, I won't go into too much depth about it because we could talk all day, honestly. But the microbiome is amazing bacteria that lives in the gut that controls so much of how we feel, so much of how our body works. It's a direct connection between the gut and the brain. And when the gut bacteria is affected adversely, the brain is going to be affected adversely. So that mood, that depressed feeling, that anxiety, it's coming from the gut, and alcohol is affecting that. Okay. What else do I see women with? I see women who complain of low desire. Alcohol negatively affects desire and libido. I see women who talk of fatigue. Oh my goodness, fatigue. Midlife and fatigue. And we're supposed to be able to say, oh, well, we're getting older and that's just the way it is. Well, it's not. So we have these amazing little organelles in our cells. They're called mitochondria. And mitochondria make energy for us. They're amazing. But of course, you probably know what I'm going to say. Alcohol has a direct negative effect on our mitochondria. So energy is affected. Even if you're not drinking an awful lot, and what is an awful lot? But even if you're not, even if you're having a glass 3 or 4 times a week, that can affect your energy. Let's talk about cancer, right? So again, I get so many women who come, they're interested maybe in hormones for their hot flashes, but they're so afraid of breast cancer. Do you know that alcohol gives you a higher risk of breast cancer than any amount of small dose hormones is going to? And that's a fact. Also, alcohol, it's a carcinogen, so it's going to affect your risk of breast cancer, of oral cancer, stomach cancer, liver cancer, colorectal cancer. So it increases the chance of all those, and I think that it might have a direct effect on other cancers as well. So I'm always surprised when people don't know the carcinogenic effect of alcohol, and this is a modifiable risk factor. This is something you can do to decrease your risk of these cancers. So again, I just think you need to know it, okay? I get people who complain of weight gain in midlife and beyond. Well, when we drink alcohol, those are empty calories. It's pure sugar. It's increasing your insulin levels. And when insulin's high, you're going to get weight, and especially around the middle. And that middle weight, it's called visceral fat, is dangerous fat. It's metabolically active. It causes inflammation in the body, and inflammation causes all disease. Okay. What else? I get women who, with osteoporosis risk factor, alcohol. Okay, and alcohol increases your risk of falls as you get older. Skin. So the effect of alcohol on skin is proven. So when people stop drinking, their skin gets better, their complexion gets better. Again, motivation, concentration. So there's a direct link between alcohol and dementia and Alzheimer's disease. So that's a risk factor. Okay, so I know that for years we've been told that, if I have a glass of wine a day, it's good for my heart. Right? That's been shown to be good for my heart. Well, in 2018, the medical journal, The Lancet, which is like well-known medical journal, studied the effects of alcohol in 195 countries between the years 1990 and 2016. And they summarized by saying no level of alcohol is really safe. And they found that alcohol is the leading cause of disease in the world. There's the sobering facts. So what I want to say is, you're midlife, you're not feeling very good. Maybe you're younger than that, you're not feeling very good, you're not motivated, you're feeling moody, whatever the case may be, you're putting on weight. 30 days. Take 30 days. Do a 30-day challenge, no alcohol, and see what happens in your body, in your brain, in your life, in your relationships, even in your pocketbook, because it can be pricey as well. So take 30 days. Think about it. Look at your calendar and decide when. But it's one thing that you can do that I 100% tell you will positively affect your health. and your energy and your disease risk and your sleep, so many things. Okay, and once you get to, have done 30 days, maybe you're going to want to do another few months, because some studies show that it can take 3 months to really form a habit and to really see what change does in the body. Okay, I think that that's about it. If you have any questions, you can always contact us at NutriChem Pharmacy. This is our passion. One thing I will mention too is, at the end of 30 days, you may say, well, I still have, digestive issues, or I still, I'm not feeling the greatest. That's where we can jump in and help on the other stuff. But this is one thing that you can do today. It'll positively affect your gut microbiome and all of the other things that I've talked about. And don't replace any alcohol with pop, please. Pop, that's another video that we'd have to do at another time. Water, sparkling water. We want to replace alcohol with good stuff and good habits. And maybe if you're not drinking, you're going to be more motivated to exercise and add that in too. But right now we'll stick with 30 days being alcohol free. Okay. Let me know how it goes. I'd be happy to have feedback, and stay well and let us know of questions. Take care. Thanks for joining me.